Hello, everyone. Hello. And welcome to another episode of Environmental Justice Now. My name is Leah Jones, and I am the organizing coordinator and water justice organizer here at Virginia Interfaith Power and Light. Welcome back to another episode. And as before we get started today, as usual, I'd like to do a brief land acknowledgement. While we are on a video call, and many of us are joining in from all different places, it's important to remind ourselves that we do gather on the unceded land of the indigenous peoples. I am joining in from so-called Richmond, Virginia, and I am currently located on the land of the Powhatan and Chickahominy peoples. So if you are unsure of whose land you are on, and you would like to learn more and find out, you can always visit native-land.ca to find out more and learn. So once again, thanks everyone for returning for another episode of Environmental Justice Now. This month we are in a new month. This is a new start. May. We have finally reached the end of April. I can't believe that it's May already. But May is actually the month of many health related observances. So this includes all sorts of health related observances like asthma awareness month, mental health awareness month, and Women's Health Week, which is just coming up in a few days. So it is ultimately essential to understand why public health is actually an environmental justice issue. The two are closely tied together, actually, and that's what I'm here to talk about today. We see that this issue is especially relevant because Richmond, Virginia, here where we're located, is actually ranked the 12th highest in the asthma capital of the United States, according to the Asthma and Allergy Foundation of America. So with that being said, we see that once again, our neighborhoods, our local areas are feeling the impacts that are associated with environmental racism and the issues that continue to worsen because of the climate crisis. Now, how might you ask, if you haven't heard already, some of the ways in which these two topics, environmental racism and the health of our communities, are tied together? That's what I'm going to share a little bit more about today. As we've all shared week to week, we see that many communities here are not benefiting equally from the Earth's gifts. Some communities are enduring more burdens than others and have endured inequitable burdens of toxic air, water, and pollutions in their homes and neighborhoods for generations. Especially Black, Brown, Indigenous, and low-income communities here in the United States are disproportionately affected by environmental issues. So this can look like environmental racism and specifically targeted areas, like I just mentioned. And we see that even here in our local areas in Virginia. So in the United States, environmental racism directly stems from historical Jim Crow laws and redlining policies and has far-reaching impacts to this day, and even on global environmental policy. So some examples of environmental racism can include practices to zone African American communities for toxic and polluting industries like landfills, dumps, pipelines, other corporate entities who are also coming to site energy production, energy pollution near these Black, Brown, and Indigenous owned lands. So we at Virginia Interfaith Power and Light actually work closely with communities historically and disproportionately affected by environmental racism. We have we recognize that Black and Brown communities, along with the other marginalized groups that I mentioned just in this episode, have systematically for generations been forced to live in industrial zones and breathe in polluted air that ultimately impacts their health in a negative way. Respiratory issues early onset diseases, cancers, uh, cancers appearing in communities that are heavily exposed to toxins and industrial sites. These are some clear examples that we see that communities, often with higher pollution, have an increase in the respiratory infections, the heart disease, and all different sorts of cancers. So these are easily tied together. Our environments can directly impact our well-being. So many of these conditions can also honestly be found in communities that are near highways and interstates. And there are just a couple of things that I wanted to point out today that kind of back up what uh, that kind of back up these examples that we see even on a local level here in Virginia. So our partners and friends over at We Act, an environmental organization doing awesome work on a federal level and locally in the DC area, actually have this great resource that lists the different things that contribute to or the different things to be cognizant of rather when considering the ties between environmental racism and our public health of the health of our communities. That being said, they once again iterate this and emphasize this point that people of color and lower income people are more vulnerable to asthma itself. And while asthma can affect individuals of any race, age, or ethnicity, the prevalence is closely tied to race. And actually, African Americans are 3 times more likely to stay in the hospital because of asthma and 3 times more likely to die from asthma than white counterparts. Historically, even Black people and other minority groups in the United States have been disproportionately affected by environmental hazards. And this was actually found out and reported on by the United Church of Christ Commission on Racial Justice all the way back in 1987, which found that while socioeconomic factors definitely play a role in where toxic waste sites are located, race is definitely the most significant factor. And these practices are still very prevalent today, as we see where our most polluted communities also are probably communities of color, even here in Virginia. And we continue to see that to ring true, and this point here to be proved by various publications. A few that we've noticed that I found in particular that I wanted to share with you today. The first is one that I'll never forget. It is a Times article that actually is titled, Your Zip Code Might Determine How Long You Live, and the difference could be by decades. And the article is basically bringing to life and proving with maps and all of this great info the ways in which where we live specifically, our zip codes can indicate so many things in our life that it can impact how long we live on this earth. And that inherently means our environments where we live, where we spend our lives, directly dictate how long we are able to thrive and how well we are able to thrive and live a healthy life during our lifetime. Specifically, the article, one quote that I wanted to share is they say, a zip code's influence on the health of those living there is multifold. Where you live directly affects your health in a number of ways, from exposure to air pollution and toxins to accessibility to healthy food, green space, and medical care. And today I just wanted to share even just this image from the article that is actually a map of DC, where we can see the life expectancy differences between neighborhoods in the area of DC. And I know DC isn't exactly Virginia where we are, but it is just a hop, jump, and a skip away. It's one of our neighbors, right? And we see in some areas here where um, and where the map is heavily saturated in the red color, that we see a very clear start gradual difference in the age expectancy from the top corner of this map over where people are living to be 90 years old to the bottom corner of this map where people are instead averaging at 65 years of age. And so this is nothing to shake a stick at, right? And if you think about it, if you're consistently breathing in toxins every day, not only outside, but these are also, we can find that oftentimes in toxic areas, even if we have toxic air on the outside, especially without air purifiers or anything to protect yourself from the air that may be entering your home, you can find that your the indoors of your home is just as toxic as the outdoors, which continues to harm you and be a harm for your families, right? And I know that image that I shared was of DC, but we can see some of those same uh, patterns exemplified here in Virginia and even more locally for us in Richmond. And we actually just last year recognized this has been an ongoing conversation that we've been seeing throughout the city about urban heat islands and how certain areas are disproportionately impacted by heat, and in turn, by uh, shaking up there for a second, are impacted negatively by their surroundings and this heat, which also means that we see those exact same patterns that I was just sharing about DC. So, once again, this article from Richmond Times Dispatch just came out actually just last year, titled Richmond Urban Heat Islands. Scott's Edition, Jackson Ward, Manchester is putting communities in danger. And the article goes on to talk about how Manchester is actually one of the hottest neighborhoods in the city of Richmond, along with Scott's Addition, Jackson Ward, Monroe Ward, the Diamond Districts, and part of Virginia of the VCU area. And what all of these areas have found in common are the fact that, in addition to the higher heat levels, we see less green space, more pavement, which also in turns means air quality is lowered. In these areas, there's more pollution in the air. Communities could be having a harder time breathing. Communities are having more opportunities to breathe in up unhealthy air, unhealthy toxins that aren't being regulated by any other green space, any trees. That help to put clean oxygen out for us to breathe, and instead are just reflecting the heat off of these impervious surfaces like blacktop and concrete that do nothing but reflect the heat back into our atmosphere. Um, so all around, multiple things worsening the health of these communities, right? And just to keep along that same, to add on to that, I guess, and to kind of keep along that same line of the things that contribute to air pollution, at adding green space being one of them, a major one. Another one is definitely our access to public transit and how transportation, uh, transportation, and rather the lack of transportation, public transit, contributes greatly to the pollution and toxins in our air as well, because of all the cars that we're driving around every day, right? So one way to actually reduce this air pollution is to expand our public transit and accessibility, and increase ridership. And so we are actually encouraging this summer, specifically this May, during this month full of health related observances, We are asking for folks here in Richmond, Virginia, folks in Roanoke, Virginia, and folks in Petersburg to register for our event, Ride the Bus Week, which is happening May 14th through the 20th. We'll be sharing our information to register in the comments very shortly. So please be on the lookout to join us. We are in desperate need of a robust public transit service so we can improve the quality of our air for everyone and our quality of life for everyone. We definitely acknowledge here at VPL that everyone has the right to clean air, good health, and a sustainable future. So let's try our best to continue to create a world together where all of creation can thrive. And thank you, everyone, for your continued help advancing climate and environmental justice. We are so grateful for you tuning in today, and we are hopeful for you to participate in Ride the Bus Week. As usual, if you would like to keep up with all things VIPL, you can check us out on our website, and you can also join us by being a supporter by joining this list here. And we look forward to see you all next week on the same time, same place, here for another episode of Environmental Justice Now, or hopefully around at some of our upcoming events like Ride the Bus Week. All right, everyone, have a great Friday, have a great weekend, and I will see you next week. Bye-bye.